talk about is why this is a good plan option for so many of your clients. We're going to help you identify how the plan works. We're going to focus a lot on how to sell it and who the right client is for this plan. It's not for everybody, but it's for a lot of people. And we're going to start with who those people are. And my favorite category that I like to look at are people who have an HSA. So what's the difference between an MSA and an HSA? Well, they're similar. I have an HSA from my family. HSA plans are available for people who are under 65. MSAs are available for people who are over 65. And I'm a licensed agent and I love to sell, so I can't help myself by talking about a lot of sales points. But one of the things that's critically important difference between HSAs and MSAs is with an MSA, the client does not contribute to their MSA account. That's part of what the company does. And that deposit is done right at the first of every year. So I've got an HSA account and I think it's $592 is what I contribute to my family's HSA plan every single month as I try to maximize that. So anytime you find someone, especially turning 65, that has an HSA, that's low-hanging fruit, guys. You need to be thinking this plan is built for them. Why? Because all the money that they've put into their HSA account over the years, they can use as part of their Lasso MSA plan. Again, they cannot contribute to their HSA, or they, in fact, cannot contribute to their MSA account at all, but they can use the funds that they have stacked in that HSA account over the years. So MSA is one of the many different types of Medicare Advantage plans that are out there. We've got HMOs, PPOs, obviously those being the two most common plans that are out there. MSA, for years, those were the plans that a lot of agents, the questions that a lot of agents missed on their AIP test because, they weren't available, or they were available in very few areas. Well, this is the third AEP that Lasso has been available. And when we go through the map here in just a moment, you'll see that this plan has expanded rapidly. And believe it or not, it is available in more counties than United Healthcare or Humana or Aetna or any other Medicare Advantage plan. It is available in more places than any other product out there. Because if this plan is available in the state, it's available in every single county in the state. And a little teaser, a lot of the counties that are rural, and especially a lot of the states that are rural, this product is especially well designed for, because as y'all know, where you have those RPPO plans that are available in every county, typically those are at the maximum out of pocket that are available. The networks are really tight, and there's a lot of exposure for the client as far as their out-of-pocket cost, co-insurance, and co-payments. So this plan competes incredibly well in rural areas and in rural states for that matter. But I jump ahead, pardon me. So MSA is probably the simplest Medicare Advantage plan there is. There's two parts that you need to be aware of. It's a high deductible Medicare Advantage plan, and then it has the actual MSA account, or technically a trust or a custodial account. So what we've got is those are the only two things that you need to be aware of with the MSA. I'm sorry, the product, we keep having some issues with this muting for some reason, but there's only two things you need to be aware of with an MSA: the deposit and the deductible. And for 2021, it's gotten even simpler. We've got two product availabilities, two plan options for the client to choose from. The first is the Growth MSA, which is a $2,000 deposit into the MSA account with a $5,000 calendar year deductible. And the member responsibility is $3,000. You can think of that as a maximum out of pocket on this plan is $3,000. And then the Growth Plus MSA has got a higher deposit and a corresponding higher deductible with a member responsibility of $5,000. People who would be good candidates for that, people who are in really good health. They're comfortable with the risk. They want the extra $1,000 deposit, and they're comfortable having some additional exposure to get that. People who are in this plan who bought it in the last 2 years, the plan designs were different. We had up to 3 different regions, possibly in a state, and the difference was $1,000 different deductible in the states where there were 3 different regions. Well, what we're doing for 2021 is every person who has bought any of the different plans, no matter if it was region 1, 2, or 3 in the different states, are all going to be crosswalked to the growth MSA, the $2,000 deposit with the $5,000 deductible. People can elect to go to the Growth Plus MSA if they want, but it will default to putting them in the $2,000 deposit, $5,000 deductible. I think of states like Mississippi, where everyone was in region 3, the entire state was region 3. To go from region 3 to $2,000 deposit with a $5,000 deductible is a massive upgrade for people coming from region 3s. Region 3 was often in the rural areas of states, or a state like Mississippi where it was the entire state. So that's going to be a huge bonus for people who are in the plan right now. They're going to love seeing the fact that they're crosswalked to the growth MSA. One of the things I love about these plans is it's not use it or lose it with the MSA funds. The funds roll over from year to year. And let's go ahead and jump over to the, here we go. Let's look at the next slide here real quick, and just for a second, let's go ahead and look down at the bottom right, where it talks about what the deposits have been with this product over the last, 2 years. And if we look at 2021, let's look at 3 years. This is truly the only Medicare Advantage plan where people have the chance to win financially. By that, they're basically betting on their health care, and which is really no different from what people do in traditional Medicare Advantage plans, right? They're rolling the dice that they're going to be healthy and that they're going to benefit from a 0 premium on a regular, or often a 0 premium on an HMO, and not pay the med sup premium that may be $100, $150 a month. Well, with the MSA, you've got the additional benefit of not only a 0 premium, but you're getting that deposit the first of every year. So someone who's going to have this plan now for the 3rd year, they will have received, let's assume they do the $2,000 plan this year, they will have received almost $8,000 deposited into their MSA account over the 3 years that they will have been in this plan. So if we think about the $2,000 plan, again, it's got a $5,000 deductible with a $3,000 maximum risk. And just to go back, we'll look at that real quick. Again, we've got $2,000 deposit, $5,000 deductible, $3,000 member responsibility. They've got almost $8,000 if they've not used their plan. So literally, they are now at a point where they've got enough money in their MSA, now that they're in their 3rd year, to where it can cover 100% of that member responsibility. Wow, that is powerful, very powerful. So let's kind of do a quick comparison of MSA versus the other plans. So HMO, obviously we've got very tight networks, typically 0 premium, low maximum out of pockets, 3,000 to 4,000. PPO, we've got larger network access. Premiums are going to be higher, probably $30 to $50, maybe more per month. And the maximum out of pocket, if they go out of network, of course, is going to be double than the in-network maximum out of pocket. With MSAs, as far as network access, that's one of the beautiful things about this plan. They can go to any Medicare provider that's accepting new clients. Guys, this is the closest thing you can get to a Medicare supplement in the Medicare Advantage space. And that's one of the reasons why I Taylor Martin, buy this plan when I'm 65. Because unlike an HMO or a PPO, I go where I want. It's interesting. One of the groups that really love this plan are RVers, because they travel all over the country in their Airstream or their coach or whatever you call their vehicle. And they love the fact that they can go wherever they want with this plan. very similar to original Medicare with or without a Medicare supplement. So network access is one of the hugest selling points with an MSA. Zero premium, it has to be. It also does not include a prescription drug plan, which you could say is a negative. I like to think of that as a positive because the client gets to enroll in a plan that works best for them, not that is just part of the plan. Take it or leave it. So you look at the maximum out of pocket, right above the highlighted deposit that I have in the bottom right, and you'll see what those ranges are. So in this year, it's very simple. It's 3,000 or 5,000. In the previous 2 years, as I mentioned earlier, there was a Region 1, Region 2, Region 3. That's going away. Everyone who had bought this plan previously is going to be moved into the $3,000 plan that we've been talking about. Okay, timing of enrollment and disenrollment. Well, the thing about MSAs is it's a little different. There's really two opportunities to enroll in this plan. AEP and turning 65. Because of the deposit, it's very limited as far as making changes outside of those two times. OEP is not an option to enroll or disenroll in an MSA plan. So again, and there's very limited SEPs. Obviously, if somebody moves out of the area, of course. But outside of that, talk to one of our marketers. We'll give you our contact info at the end of this. But it's very limited. And again, it's largely because of that big deposit that they get the first of the year. So again, remember, turning 65 and AEP, those are the opportunities. Where's this thing available? Well, gosh, almost everywhere. This is incredible. In 2019, we launched with 17 states. And then we got to 26 last year. And we added 8 more in 2021. As I started off by saying this product is available in more counties than Aetna, than United Healthcare, than Humana, any other Medicare Advantage. This product is in more counties than any Medicare Advantage plan, period. And some of the additions for 2021 are huge. Oregon is a massive Medicare Advantage state. So is Florida. Massachusetts, Missouri, Oklahoma, West Virginia, Alabama. And a lot of people think West Virginia, probably not a really good Medicare Advantage state because it can be very rural. Well, as I started off by saying, believe it or not, those are some of the best areas for this product because again, the competition is not very good because it's hard to do strong network-based plans in rural areas. In fact, states like Montana are some of the biggest producing states for this product because, again, this product gives you the access to any provider, and you've got, the $0 premium plus the deposit. It works really well in the rural areas, especially when there's very other Medicare Advantage plans that are available. So again, great footprint as far as where this product's available. I anticipate as we look at 2022, not to get ahead of ourselves, that this map will continue to get filled in. Guys, this is a huge access opportunity for your clients. Who can join an MSA? Well, they've got to be eligible for Medicare. That's an obvious one. It is a Medicare medical savings account. And they got to live in one of the service areas, which, as I mentioned earlier, is if they're in that state, it's available. This product is available in every single county by law in every state that it's in. So it's really simple as far as knowing where it is because it's in every county. They have to reside in the U.S. for 183 days or more during a calendar year. That's just kind of typical. This next bullet is one you need to make a note of, and this is one that's been a problem that should get your attention. The MSA plans are not available for people who have access to the VA, who are registered and use the VA, that are also on TRICARE, or Campus, or any of the veterans insurance where they get prescription benefits. And that's because it's people on an MSA cannot have prescription coverage. So again, the other option, the other group that are not able to get this are people who are on eligible for Medicaid, and also people getting hospice benefits. So Medicaid, not eligible, and people receiving VA benefits. They can be eligible, but not receiving VA benefits. But again, anybody on TRICARE, Campus, those types of retirement, VA, the retirement type plans are not eligible for this product. Please keep that in mind because that is important. We've touched on some of this, but let's really take a deep dive on who are the good candidates for this. Who should you be thinking in your head when you think of your clients or potential clients that are good fits for this? Well, people who are interested in MA, but don't like the network restrictions. That's number one. And that, as I mentioned earlier, really bleeds into med sub clients as well. And we'll touch on that in just a moment. I opened with this, but people who have an HSA plan turning 65, guys, this is the plan for them. They're used to high deductible health plans, and they have a stack of cash, hopefully in their HSA account, which they can continue to use. They can't contribute to it anymore because the MSA plan will make the contribution for them. I mean, I wish my HSA plan got a deposit every year from the insurance company. I can tell you, it doesn't. Well, once they hit 65, that's what happens. Beautiful thing. People who are healthy, put another way, have low medical expenses, that are interested in the idea of winning, because again, they get that deposit and they know that they're not going to be likely using much of it based on previous year's expenses. And we don't have the numbers yet for 2020, but for 2019, guys, this is one of the things that should blow your mind when you think of why this is such a good option for your clients. In 2019, just under 90% of the people in this plan did not hit their deductible. Those that did, it was due to an inpatient stay. So we're going to touch on who's not a good candidate for this also a little bit later in this slide. But again, under 90% did not hit their deductible, just under 90%. That's amazing, guys. So it tells you that by far, 9 out of 10 people are winning with this plan. Because again, those funds get rolled over from year to year. Clients in rural areas, I touched on this. I'm in Fort Worth, Texas, where I sit today. And once you get outside of the major metro areas in Texas and so many other states, there fortunately are Humana and United Healthcare plans that are often in every single county in the state. But typically, those are at the $6,700 maximum out of pocket. They've got very limited networks, and especially in counties where there's just not a lot of providers or hospitals that can use them. This is the plan you need to be talking about with your clients. And additionally, you can help them enroll in the prescription drug plan that is going to work best based on the drugs that they take versus the one that's just part of the Humana or United Healthcare plan or whatever MA plan is available in some of those rural areas. So again, clients in rural areas, you absolutely need to be thinking about this because of the access, the deposit, the zero premium, and the ability to choose their own PDP. This one is one that I love. Uninsurable med sub clients or high premium med sub clients. Maybe they've been in the plan for a few years, whether they can change or not. Maybe they're paying, $150, $200 or more a month. That's not uncommon. We see it all the time, especially as clients get older, that those premiums can jump. Well, with the new plan design of the $2,000 deposit, $5,000 deductible, and you back out that $2,000, you get the $3,000 member responsibility. I mean, we're almost, for somebody who's paying $250 a month, guys, that's $3,000 a year in premium for a med sub. Just by saving that premium by going to a zero premium product with the Lasso MSA, then you figure in the $2,000 or $3,000 deposit, guys, they're winning. And they still get to go where they want, just like with Medicare supplements. So they're not giving up that critical piece of access, provider and hospital access. That's important to so many Medicare supplement clients. And oftentimes those are clients who maybe might be a little bit more, they might be a little wealthier, maybe a little more educated, and this is an easier discussion for them as well. They see why this makes sense for them. They also might be people who have had an HSA and they've got funds sitting in an HSA that they could use as part of their Lasso MSA. Clients who want their own PDP. Sounds kind of silly, but Obviously, MedSup clients like the fact that they can buy their own PDP, and some of them change it every few years as needed as those plans change. We talked about who's not a good candidate for this, or I told you I would tell you who those are. And we're also going to talk about some people who are good candidates that can't even qualify for a Medicare supplement. So let's kind of pause and touch on both of those. The way you get to hitting your deductible with this product is a handful of ways. Spending the night in the hospital, as I've already touched on, is the number one reason. We'll go through claims in a minute, but what happens is the repricing to 100% of the Medicare fee schedule will happen. But let me tell you, spending one night in the hospital, that even at a repricing to the 100% of the Medicare fee schedule, that's going to hit that $3,000 member responsibility just for one night. So spending the night in the hospital, if they have a condition that dictates that they often spend the night in the hospital, this is not a good product for them. People who have cancer, likely also not a good product for them, because again, they're paying 100% until they hit their deductible for the reduced Medicare, 100% of Medicare fee schedule for chemo and radiation. There's not a lot of hospital stays for cancer, but radiation and chemo will get them to that deductible. People who know they're going to have a knee or a hip replacement or a very expensive surgery that they have an idea is coming. Those are all people that I would tell you this plan doesn't make sense for them. But what they can do, especially the knee replacement person or the hip replacement, something that once they get done and it's behind them, they can get out of the plan during AEP and come back to it the next year if they want. And the funds that are in their HSA or MSA account will stay there, and they can use them the following year when they come back. So outside of those groups, this plan really works well for almost everyone. And it actually works really well for people who've got managed chronic conditions that might not even allow them to get a Medicare supplement. People who've got COPD or emphysema, they're going to have a hard time finding a Medicare supplement that will accept them. People who are taking over 50 units of insulin also typically have a challenge finding coverage. People on Medicare disability that have are disabled for, maybe they lost an arm, or, they have something that keeps them from being able to, they're physically disabled that keeps them from working, but one that's not generating, again, inpatient hospital stays, cancer treatment, major surgeries that, that are going to make them hit their maximum amount of, or their member responsibility or their maximum out of pocket. So there are people that literally couldn't qualify for MedSup that are good candidates for this plan. So those are a few just to keep in mind. Why choose this plan? We've covered some of this. Again, it's the only product that gives you money, provider choice, which for me, Taylor Martin, is critical, and I think so many of your clients will say the same thing. I want to know that I can go to MD Anderson if I get diagnosed with cancer. Well, with Lasso, you can. I love that. And I love the fact that I can win. So let's talk about what the funds deposited in your MSA account can be used for. This slide does a great job of identifying what those are. So qualified medical expenses, qualified Medicare A and B expenses, the light gray inside the darker gray frying pan, if you will. This is the obvious stuff. Hospitalization, physicians, x-rays, lab tests. Obviously, all of that counts towards your deductible, and it's tax-free as far as using your MSA funds. Those are some of the obvious ones. But it's the outside frying pan, the darker one, if you will, which gets me so excited about this plan. These do not count towards a health plan deductible, but the MSA funds can be used to pay for eyeglasses, to pay for dental expenses, cleanings, dentures, hearing aids, prescription drugs, because again, these are qualified medical expenses. Again, they don't go towards your deductible for the MSA plan, but you can use the MSA funds to pay for those. I always tell people who are looking to buy this plan, don't use it for that in the first year. The example I gave you earlier of someone who's been in this plan now for 3 years, if you include the deposit coming at the first of the year, they're going to have over $8,000 in their account. and their exposure, their member responsibility for 2021 is only $3,000 on the most common plan. So absolutely, they should be using their MSA funds for some of those other expenses that they're allowed to use them for. I know that's what I'd be using for. So that's one of the things I love about this plan is you can use those MSA funds for things outside of what counts towards the deductible. That's great. What you shouldn't use it for is stuff like food, electronics, rent, things that are not qualified medical expenses. That's a huge no-no. Your client will get a little note from the IRS because that's going to be taxed as income, and they'll get a 50% penalty. Don't use it for that. Let's talk about enrollments. Enrollment is very similar to a traditional MSA or a traditional Medicare Advantage plan, except for one key difference. They also have to enroll in the Medicare savings account, and that's with Optum. I told you I had an HSA. Mine is my HSA account actually is with Optum, and I carry around, it's actually a credit card that I use if I want to use any of my HSA funds. Well, obviously they got to have the account if they want to get the MSA set up and get that credit card where they can use their HSA or MSA funds. So they will apply with the MSA application, the application for Lasso. They can do that online at lassohealthcare.com or use paper apps. I highly recommend the e-app. It's a much quicker process. They get their deposit on the first of the year, or if they are joining on their birthday as they turn 65 during the year, that amount will be prorated based on the number of months that they will be in the plan. So if they enroll in February, do the math, they won't get $2,000, they'll get very close to it. If they enroll in October, they won't get, they'll get much closer to, $600 or $700 depending upon the math, because again, it is prorated depending upon when they enroll. And then they'll get their cards in the mail. And when I say cards, I mean their health insurance card from Lasso and their MSA card from Optum after they enroll in the plan. Okay, how do they use this plan? Well, it's different from a typical Medicare Advantage plan. So let's help understand how that is. So when they go to the doctor, they give them their MSA card. And just like the HSA that I have now, I don't pay anything when I go to the provider. What's going to happen is they're going to get an EOB from Lasso that's going to show them what their coverage decision was, their progress towards the deductible, and what they will be responsible to pay to the provider. I touched on the repricing that happens. So say there's a $200 claim at the doctor's office. Medicare says, no, that's a $100 claim. Same thing that happens with Medicare and Medicare supplements. There's that repricing that happens. Well, it happens with Lasso too. So whatever that repriced amount is, if it's lower than the deductible, if they've not hit their deductible for the year, they're going to pay that to the provider, and they'll get an invoice from the provider for that amount. And they can pay that with a credit card, with cash, or they can use their MSA funds if they want. They don't have to. They can, but they can. It's up to them. And the reason why some people don't use their MSA funds is because once you have more than $2,000 in that account, you can actually invest those funds. Again, I use Optum. I've got a choice of maybe a dozen different mutual funds that I can invest in, and I do my funds that are above the $2,000 minimum for my account. So that's one of the nice benefits of an MSA account is, again, being able to invest those funds that are over the minimum that you need to have in there. So they don't have to use the MSA funds if they don't want to. Most people do, but you don't have to. All right, how to maximize the value. And this kind of goes with what I was just saying. Put together a plan. In that first year, obviously the deposit they're getting, if they're going with the plan where they get the $2,000 deposit, they've got a $5,000 deductible. So again, they've got a $3,000 member responsibility. The difference between the $5,000 and the $2,000. If something goes to where they have to spend the night in the hospital or they have a bad year medically, they know in that first year, make sure they understand that they will have to spend money above and beyond that deposit. So that's what we mean when we say put a plan together. In the second year, definitely the third year, depending upon their usage, they should have enough money in that account to even cover the deductible. potentially quite a bit more than what they need to cover the deductible. Again, limit the funds, as we touched on earlier, that in their MSA accounts to pay for things like dental, vision, hearing, prescriptions. I don't recommend using their MSA funds for those. They can, it's not illegal, and it's a great thing, but in the first year, I would try to limit the funds for those non, A and B type expenses to where they have all that money still there if something bad happens. I mentioned this just a moment ago. Once they have more than $2,000 in their account, they can absolutely invest those excess funds in, mutual funds. That's what I do in my account. I love it. Preventative services. This is one of the things that's unique about Lasso. And frankly, they do this because unlike all other Medicare Advantage plans that are not an MSA, MSAs are not allowed to do the free annual physical or the Welcome to Medicare physical. Because again, this is a high deductible health plan. So what Lasso does is they give the client a $100 gift card once they complete their annual physical, their annual wellness visit, whatever you want to call it. Because Lasso wants them to do that, and they're trying to encourage that good behavior by giving them a $100 gift card. They get a $75 gift card if they complete a health survey annually. And they get a $75 gift card when their labs are ordered and they discuss results. Typically, all of that is going to happen at their annual doctor visit where they're getting their physical done. And if they submit the paperwork to get that stuff done, they're going to get reimbursed $250. They're going to get gift cards for $250, which is roughly what the 100% of Medicare fee schedule is for those things. So it should be a wash for them. Again, Lasso's trying to give them, encouragement to get all that stuff done because again, they can't cover it because of it being a high deductible health plan. Cross-selling opportunities. Probably some of y'all have had this in your mind. What are the different plans that fit well with Lasso? Well, guys, this is the best platform I can think of to cross-sell. Why? Because number one, it's an MA only plan by law. There is no drug coverage as part of this plan. So a PDP is always, I should say most often going to be sold with this plan. And as I touched on, figure out which plan makes the most sense for the client based on the drugs they're taking, which I love also. It's not forcing them to have the drug coverage. That's just part of their Aetna, Humana, Cigna, WellCare, whatever MA plan that they may have had previously or are considering. You can really get them the best PDP plan. I say best because it best fits the drugs that they're taking. So that's going to generate you a commission, and we'll look at that commission in a moment. Dental, vision, and hearing. Absolutely. Just like Medicare supplements, that is the #1 plan after PDPs that are cross-sold with Lasso. We love the Manhattan plan. I'm a little biased. We helped design that plan. Aetna's got a good product. Obviously, Emeritus, there's a lot of options out there, but absolutely, you need to be talking to your clients about dental, vision, and hearing because this plan doesn't cover that, just like original Medicare. Cancer, heart attack, and stroke. Those are 3 things that you will more than likely hit your deductible if they happen to you. Cancer, as we discussed earlier, you're looking at 20% of the cost of radiation and chemo up to your maximum out of pocket or your member responsibility for the year. Heart attack or a stroke, those are almost always going to involve spending the night in the hospital. And as I mentioned earlier, typically, if you spend 1 night in the hospital, you are going to hit your member responsibility for the year with this plan. But the good news is that's really affordable. $10,000 of cancer-only coverage at age 64 is $25.50 with Aetna. I know that because we know that product backwards and forwards. My business partner and I helped design it, and it is a fantastic product. What you can do is you can actually sell a $5,000 lump sum cancer and a $5,000 cancer heart attack and stroke plan, separate cancer and a $5,000 heart attack and stroke, which will be a few dollars more than that, but still under $30 a month at 64, under $1 a day. So very affordable. And we'll look at what those premiums are going to do for commissions in just a moment. So another great product to sell the client. I mentioned deductible guards specifically because we helped design that product with Standard Life and Casualty, and it is a lump sum hospital indemnity plan. The typical Medicare Advantage plans that are sold with the leaders in the hospital indemnity space, your GTLs, your Aetnas, et cetera, those products are really designed more for, covering that $300 a day inpatient in the hospital or $250 ambulance. When we designed this deductible plan product with Standard Life and Casualty, it pays a large lump sum for the first night in the hospital, and it also has a rider that can cover outpatient surgeries. I'm not going to go into any more detail on that, but if you're interested, please reach out to a marketer at the end of this call and they can go over those plan designs with you and see if that's a good fit for you. So, great platform to cross-sell with Lasso. Certifications, guys, I have done United, I've done Aetna, and I've done Lasso so far. God, I wish they were all as easy as Lasso. It's open book, 20 questions. I think it took me 6 minutes this year, down from 7 minutes last year. They take AHIP, in fact, they require it, but it is the most painless certification there is. And again, it's open book. The answers are all there. If you use Control F and know how to search for them or dig through the agent guide, everything you need is right there. It's very simple. All right, what's in it for me? This is our last slide, guys. We made it. And this is my favorite slide because this is what motivates me, as I'm sure it motivates so many of you. It's what you get for your hard work and for taking such good care of your clients. So let's talk commissions. Well, the MSA pays the maximum allowable commission that Medicare allows in 2021, and that's $539. There are a few states like Pennsylvania where it's a little higher, but that is the normal commission in pretty much every other state. The replacement or renewal, if somebody already has an MA, is going to be $270. Somebody new to Medicare getting a PDP, we're looking at $81 with most of your companies out there. Again, that's the maximum PDP commission, so most companies will pay that. Replacement renewals, roughly half that. Cancer, heart attack, and stroke, we touched on that a minute ago. So a $10,000 policy, again, $25.50, the cost of a $10,000 lump sum cancer plan with Aetna at age 64 is $306 in annualized premium. At a 55% first year commission in most states, we're looking at $168 in year one commissions. Notice no renewals are figured in here. Obviously, all of these plans pay renewals, which is a beautiful thing. Dental, vision, and hearing, we're looking at a premium of $444 with Manhattan Life for a $1,000 policy with 40% first year commissions in most states. We're just under $200 in year one commissions. So adding all of this up, we're at almost $1,000 per person. So that means if you enroll a husband and wife in the same house, which happens all the time, you're closing in on $2,000 per person for a zero premium Medicare Advantage plan. Wow, that's powerful. Again, they get to go where they want. Provider access is a huge selling point with this. They get to enroll in a PDP that actually fits their drugs that they take. They have a chance to win by getting that deposit. And if they're like 90% of the people in 2019, they don't hit their deductible. So there is a huge chance to win with this product. Again, I buy this plan when I turn 65 because of the way it's designed. And I'm an HSA enrolled person myself right now, so I love the fact that I can use my HSA funds that I have stowed away for several years. So again, I hope that you have enjoyed the presentation today. If you have any follow-up questions, please reach out to one of our marketers. You can email us, you can call us. The numbers and the email are on the screen. Thank you so much for your time. I hope everyone has a great AEP and adds Lasso and has a lot of success with your clients with this product. Thank you.